Hi, everybody. This is David Nevins for Citybiz List, and welcome to our program today. And today, our very special guest is Michael Jessup. He's the president and CEO of Alzheimer's Community Care. Michael, welcome to our program.
Thank you, David. Nice seeing you.
Good to see you for sure. And so Michael, I've known for a while, I will tell our audience, and he is an amazingly successful, decades-long CEO of several not-for-profit and community service organizations, and has had an amazing career in that regard. And he only very recently took on this position as president and CEO of Alzheimer's Community Care. So, Michael, will excuse you if you're not yet an expert with regard to your current organization, but tell us a little bit.
David, I had to be an expert. I was in Tallahassee last week, so
okay.
It was 5 days on the list on the job, and you get thrown into Tallahassee. You kind of have to.
Well, I'm not the least bit surprised. So. Tell us a little bit about Alzheimer's Community Care, what they do, and your service area as well.
Sure. So we're in Palm Beach County, Martin County, and St. Lucie. We primarily, we're an organization that really, I would say, provides a community-based, friendly or family-centered care for patients and their family. And I think I like to highlight this. I'm always about certain words in your mission statement and what they mean and how important they are. And, ours is providing care for people with neurological disorders. But I think the biggest thing is we have our tagline, I'm not going to say, or our mission talks about where there is help, there is hope. And for me, I think the word hope is so important. It's not just in everyday life, but especially in the lives of those that are dealing with a medical condition. If you don't have hope in your regular life, or even better tomorrow than you already have, and if you're a patient, the importance of having hope is so vital to your overall, I would say, emotional and physical health. And I think that's one of the things I've told, and even when I was in Tallahassee, when I was going through the interviewing process here, that word is vital. And I applaud this organization for the emphasis on that word hope. And then in conjunction with that, the word help. But we're out in the community. We have 12 daycare centers for neurocognitive disorder patients. Primarily, you're looking at Alzheimer's disease and dementia. Our 12 centers have the seal of approval for as specialized Alzheimer's adult care centers, which is a very I would say elite sort of classification. We've been approved and accredited by the Joint Commission. We've been approved by Nonprofit First. So we are, when people in those three counties think of adult Alzheimer's daycare help, activism, they look to us. I think one of the greatest things about this organization is that we are so highly regarded. We can, wherever I go, whether it be Tallahassee or out in the public, if I'm down in Fort Lauderdale, why don't we have one here? Miami-Dade, why don't we have one here? Tampa, you have no idea how many of the legislators said to me, we would love to have one where we are. And, I think we're into a process now, even though it's early in me being here, that we will have to begin to look at some sort of expansion to reach the needs of those people. I think I've told you this, and I've spoken this widely to everybody. We are a hidden gem. We take care of a lot of people now, but we should be taking care of more. And that's only going to occur by us being visible in the community knowing who we are, what we do, the impact we have, the quality of life we give. Because I think one of the sad things is that most family members that take care of their loved ones that suffer from Alzheimer's or dementia tend to die even before the patient, because of the stress and the work of trying to take care of those very said patients is such an emotional and physical roller coaster that many times they end up passing away sadly before the actual patient does. And I think what we try to do is keep these people in the community, not so that they have to go to a daycare or a specific 24-hour facility, that they can stay at home, have the dignity, the well-being of being around their family members. And I think that's important, that home aspect. And, if you take a look at our vision statement, one of the words in our vision statement is about safe haven. And I think that is so critical when you're dealing with any sort of medical disease, is that safe haven of your home, being around those that you're comfortable with, know that they're there in your best interest. And that's what we provide in our day centers, which allows the people to go back home during the day, during the evening with their loved ones. And I think it's just, I say we're a gem, but we're just the special organization that provides those that need it the care and the respite that they need.
And thank you, Michael. That was a great explanation, and a pretty serious organization at that. A multi-million-dollar budget. Correct me if I'm wrong. 200 or 300 employees.
We're not a small organization. We
Right.
I'm very fortunate. I have a group of colleagues here, but whether it's an RN or an administrator or a nurse navigator, a case manager, I'm lucky to have a very special, talented group of colleagues that work around me. And granted, I've only been here 2 weeks, but I'm fortunate to have them for the 2 weeks that I've been here, and I can't wait to see the special things that we can do moving forward.
And in terms of moving forward, Michael, I know your organization is active in terms of proactive and preventive brain health and the science of it as well, not simply caring for those diagnosed with it, correct?
Yeah, I think, I've said this before, and I've probably said this to you during our long relationship, that I think so many times the patients are the lucky ones. And I don't say that because they're sick, but I say that because of the attention that's given to them. They have the greatest medical care. They have the greatest pharmaceuticals. They're dealing with the greatest nurses and the greatest equipment that keep them comfortable in life. I think so many times families are the forgotten ones. They're the forgotten ones, and because they're in many instances on the outside. I always applaud hospitals that include the family members and keep them updated on everything that's going on, so they don't have that I would say hopeless, please help me, I don't understand. I think one of the greatest things with this organization is they address the families. They're included in the care. The day centers provide the families a period of where they can step away, refresh, and when their loved one comes back home, they're ready to receive them. And I think it's the attention, I'm an individual that in many instances, I believe that the families need to be really addressed almost equivalently as a patient, because so many times, like I said, they're kept on the outside. They don't understand. And when you don't understand and you see your loved one going through something, it's not a great feeling. So I applaud us in that, when you go through our mission statement, you go through our values, you go through our vision, you see the word family included in almost everything. And I just think it's a great partnership or triangle between us, the families, and the actual patient.
And Michael, listen, I think I would be shocked if we had even one viewer who had not been aware of a family member or friend who suffers from Alzheimer's or dementia or something similar. And it strikes me that with all the emphasis that we as a society have placed over the last few decades on exercise and health care and taking care of our physical bodies, the fact of the matter is we're living longer, but we haven't quite figured out how to make sure that the brain lives as long as the arms and the legs and the body, right?
Yeah. It's kind of sad. My dad suffers from dementia, and you've known my dad for years. And he has his good days, and I'm lucky he has many, many good days. But there are some days that they're probably worse than others. And, it's sad that we don't have the advancements. There are And I don't really, not having a medical background, I tend to shy away from any sort of medical, but my dad does take some medications that help him stabilize his brain and his memory. We've talked about the brain health. It's everybody talks about it, but the bottom line is that we try to keep the longer we can keep a patient at home, okay, the longer our greatest thing would be if they didn't need our day centers, that we can provide them equipment to stay at home. There's things out there now that help with repetitive memory, because not all the brain suffers from the dementia or the Alzheimer's. And there's just way of, it's almost like a golf swing. If you can train certain areas of the brain that aren't affected and allows the patient to continue to, this is when we need to eat. This is when I need the time get dressed. This is how I need to brush my teeth. And it allows them that more of an independence. I think so many of the patients, and I'll use my dad as an example, the independence aspect drives him absolutely. He almost is ashamed of it. And it's nothing to be ashamed of. It's, ask for the help and you help. But if we can help people in that aspect to keep them longer and even ultimately totally in their home, instead of needing a day center, that would be the ultimate thing. I'm not going to speak on whether they'll ever find a cure for Alzheimer's because you really don't know. But if we can help the patient and their families through our services, and we can advocate for various laws and regulations to be put in place that will allow that independence and that help and that funding. A lot of our individuals that go to our daycare centers are funded through grants that we get. So that there is no cost to the patient and families, which is even better. It's in the world of healthcare insurance and everything, and to be able to know that you can go here and you might not have to worry about paying for it, and you have this service available to you, makes us even more valuable to those that need it.
Yeah, and I know, Michael, I mean, you mentioned this 2 minutes ago, but I know throughout your career you've run a number of not-for-profits in the arts and for medical schools and what have you. But this one, the Alzheimer's Care Association, this really community care. This one really hit close to home, right?
Yeah, it did. I came down here 2 years ago, and it was to be close to my parents who, are elderly, and having friends that have lost their family members to Alzheimer's, and then my dad. This was something that it was perfect. It was a perfect fit for me. I think my background on the marketing side, my background on getting people to perform at a different level, my background in being able to bring private funding in, because there are some things that we want to do. And for us to be able to do them, we're going to need the private funding. It was just, the legislative work. It was just people talk about the right thing at the right moment, at the right time in life. And for me, given the stage of my career, the stage of my personal life, this was just a godsend for me. It was, I've worked for a lot of great organizations and I've impacted a lot of great lives. And I love to talk about when I endow a research project and I get to see that patient leave the hospital with their families and friends and the look on their face, or when I funded an interactive learning center early in my career and I got to watch the young children use the boards and stuff and their faces light up. This is for me, given the personal touch of it, or the family touch, and the fact that I've had so many friends and had so many interact with so many people, it's nice to walk into a day center, and I had a chance to visit one last week. I'll be there later this afternoon and see our other 11 ones next week or the end of this week. I like interacting with people. I walked in the other day and they were doing art therapy, and I had worked in arts and medicine and some of my funding programs like that in some of my instances of my other career life. So this was just the perfect thing for me. I'm a big education guy. I came from I call the greatest educator ever given to this country, and my dad. And we were doing our 24th annual education conference on May 17th in Palm Beach Gardens at the Marriott, and we bring together families and patients, but it's more families that come, and we teach them we have various speakers, both medically and patient wise, that come and talk, and it's an interactive day where those that need the additional information and the vendors that are out there can supply information that from what they're there, that sort of component, the fact that we're actually, I like to say the act agent in Alzheimer's for the state of Florida, and many instances, the country, some of the work that we do. I am lucky to have the greatest VP of education you could ever have. She is a godsend. I was in a meeting with her last Friday, and it's one of those instances afterwards, I turned to her and I said, I was proud to have you to the left by my side, because these are the people that we get I get to work with on every day. She runs this conference. Like I said, it's 24 years. We've got great speakers. It's on our website, alzcare.org. So if you're anybody viewing this who would like to come as a family member that is dealing with somebody with a neurological disease, please do. But it's an education. I grew up in a household where that was vital, and we provide that here, whether it's there or whether it's out in the community in a town hall meeting. We try to educate them on everything that's going on that will allow them to keep that loved one in their house where they should be ultimately.
That's great, Michael. Tell us again how our viewers can either reach out to you to learn more about Alzheimer's community care, or to register for the upcoming.
We're on most of the social medias, Instagram, Facebook, but the website is alzcare.org. And that will take you, the conference is on there. Everything that we do, our locations of our daycare centers are there. They are, you can go half day, you can go full day. A half a day is a $50 charge. The full day is a $90 charge. They get breakfast, they get lunch, they get a snack in the afternoon. They're taken care of. They have art therapy, music therapy, many other different things that keep them engaged throughout the day. With just an incredible, we have a 5-to-1 ratio. And we like to keep that ratio because it keeps a hands-on aspect for our care team with the individual patients. But we have 8 in Palm Beach, 3 in St. Lucie, and 1 in Martin County.
Thank you again, Michael, for your time. Incredibly informative, and best of luck to you and the organization going forward.
Thank you, David. Always good to see you.
Our guest today has been Michael Jessup. He's the president and CEO of Alzheimer's Community Care, primarily serving the South Florida area, but look them up, check them out, and learn more about Alzheimer's and some of the advancements and some of the treatments that they're able to provide. This is David Nevins for Citybiz List. Thank you so much for joining us today.